Talking about are just general shoulder strengthening exercises, and we're going to break them down from the easiest to more difficult. And the positioning to make it the easiest on someone's shoulder is called the plane of the scapula. And basically what we're trying to do is get the larger arm bone, which is called the humerus. We want it slightly higher than where the socket is. But to do that, what I've done is I've rolled up a towel, probably 6 to 8 inches for a normal person. Some people may need a little bit more girth to raise the elbow higher, but as long as the elbow is slightly higher than the shoulder and the arm is slightly away from the side of the body, that's the plane that we want to exercise in. The very first exercise are called isometrics, and that's basically where the muscles are contracting, but there's no joint movement going on. So we want to start in a sub-maximal effort. And usually I start patients from 20% up to 50%. There should be no pain involved with these isometrics. And that's to protect surgery, also to protect injuries. So the first exercise we're going to do is called shoulder flexion. And you put the opposite hand over the fist with the arm in this position. And what you want to do is act like you're raising the arm off the pillow. However, this arm is stopping that motion, so you're contracting the deltoid muscle without the joint actually moving. And what I typically tell patients is to do 3 to 5 second holds, and we're just going to do 10 repetitions. And you want to gradually increase the pressure and gradually let off the pressure. Okay. The next exercise, what we're going to do is a couple of rotator cuff exercises. We're going to do internal rotation first. And internal rotation is where the hand actually rotates down toward the belly. But because it's isometric, we're going to use the opposite hand to stop that motion while contracting the rotator cuff. So the patient is actually trying to pull the hand in toward the belly, but the opposite hand is resisting that motion. Once again, we want to do 3 to 5 repetitions, or 3 to 5 second hold for 10 repetitions. And you want to do an effort of about 20 to 50%, keeping it below your pain threshold. Okay? The next exercise is called external rotation. That's where the arm goes away from the belly. The elbow is bent at 90 degrees and the arm's actually rotating away from the belly. Because this is an isometric exercise, the opposite hand is actually resisting that movement, and as a patient you're contracting the muscles that would require that arm to rotate away from your belly. You're going to do 3 to 5 second hold at a submaximal effort, and you're going to do 10 repetitions of that exercise. The next exercise is we're going to do shoulder extension. Shoulder extension would be an exercise where the arm would actually pull backwards toward the bed. But because this roll towel is your elevating surface, you're actually going to be contracting, pulling the elbow down into the pillow and relaxing. You will do a 3 to 5 second hold, 10 repetitions at a submaximal effort, below your pain threshold. Okay? The next exercise can be shoulder abduction. That's actually where the elbow is going away from the body. In certain circumstances, in certain shoulder conditions, you would not want to do this exercise. Make sure your therapist has okayed this exercise before you do isometric shoulder abduction. The way to do this exercise is to hold the elbow and actually abduct the elbow away from the body. This arm is resisting that motion, and this arm is contracting your middle deltoid to try to fire that muscle. Once again, you do the 3 to 5 second hold, 10 repetitions below your pain threshold, 20 to 50% max.